Okay, good afternoon, everyone, and welcome to another social emotional workshop. I'm Tony Cureton, your host, and today we are with Lisa Kaplan from Henry Ford Health. And today we are going to be discussing depression and anxiety. Lisa, we're so glad to have you back.
Happy to be here. So, because of COVID, the amount of people who have been struggling with depression and anxiety have absolutely skyrocketed. So that's the bad news. The good news about that is it has significantly decreased the stigma, meaning there was a negative stigma in our society against people who had any type of mental health disorder. And because it is so very common now, because of COVID and many other things, that it is much more common to hear it talked about openly, hear it talked about on the news, and much more common for people to seek help. So that's the silver lining of the COVID pandemic. So how would you know if a person truly had a diagnosis of depression or anxiety? So there's a book written by a group of psychiatrists and updated every 10 or 15 years. It's called the DSM, Diagnostic and Statistical Manual. If anybody's ever had a psychology class, you've probably heard about it. And now they are on volume 5. And what this book is, it's a list of all of the substance use disorders and mental health disorders and the criteria, the symptoms needed to be diagnosed with that disorder. So for example, it might say you must have 5 of the following 10 symptoms for 3 weeks or more to meet the criteria to be diagnosed. And this is what doctors and therapists use to create a diagnosis, and insurance companies use to determine if they will pay for treatment. So the DSM is one scale, and there's another one called the ICD-10, which we won't go into, but it's generally the same idea. So you may or may not know that depression and anxiety are the 2 most common mental illnesses. In our lifetimes, about 20% of people will be diagnosed in any particular year. At 20% of people will be diagnosed with depression. So it's very, very common. So what is depression? What are the symptoms? So you might hear people complain about excessive sadness, crying spells, mood swings, either eating too much or eating too little, sleeping too much or sleeping too little. They may have low self-esteem, suicidal thoughts. We're going to talk about suicide in a few minutes. So what it is, it's a lack of motivation, lack of energy. People who previously enjoyed activities no longer find joy in those activities. So as you can see, it can really impact a person's functioning. So depression is not the same as sadness. Okay, if we had a death in the family, or our dog got killed by a car, or we got a diagnosis that was frightening from a doctor, we would feel sad. Okay, that is normal, a normal part of living, but it doesn't meet the criteria for depression. So there is a difference between sadness and depression is much more serious. It has a higher impact on functioning. It also is more deadly in terms of suicide, and it is much more severe than sadness. So there is very successful treatment for depression. Okay, so talk therapy and medication combined are the best way of treating this disorder. Okay, this is better than one or the other. The 2 combined are what is the most helpful. And after we talk about anxiety, we'll talk about what type of treatment. So the medications that are used are what we call antidepressant medications. And there's many different types of medications. The problem is it's all trial and error in terms of what's going to work and what's not going to work. And as they're trying a person at a lower dose and then increasing the dose and then maybe increasing the dose again, and then determining this isn't the right medication, so now they have to wean a person off and then start all over with another medication, it requires a great deal of patience. And people who are feeling lousy really generally don't have the patience. But once the right medication is selected, and most of these medications take 3 or 4 weeks to kick in, that's when a person can get the help that they need. Now, having said that, there is something called treatment-resistant depression. So those are people who have been through talk therapy. They've been tried on at least 2 different antidepressant medications, and they're still not getting relief. So the good news is they are taking antidepressant medications and combining them with other medications to kind of boost the system. So most of you are familiar with Ritalin, which is a stimulant given to children who have attention deficit disorder. But what they have found is that Ritalin, also used with antidepressants, can help a person to be relieved of depression. So that's one drug that's commonly used now. And the other is ketamine. Okay, so ketamine is a drug that is not legal, that people have used for abusive purposes, but now they're using it for treatment-resistant depression and seeing a lot of success. So even if someone has tried antidepressants and they're not working, there is still hope. Okay, so that's depression. Now let's talk about anxiety. So when we talk about anxiety, we're talking about worry, okay, obsessive thoughts, panicky, shaking, trouble breathing, nervousness, sweaty palms, sweaty body, concern about things that may or may not happen. So there's many different forms that anxiety can take on, but it can be very debilitating. So just like with depression, there's anti-anxiety medications that doctors can use to help a person get relief from their symptoms, but talk therapy combined with medication is really the best approach. So what type of help is available for depression and anxiety? So seeing a therapist for talk therapy while seeing a psychiatrist for medication is really the best treatment. So what kind of talk therapy? So there are therapists who specialize in multiple different approaches. And when we talk about therapists, we're talking about licensed social workers, professional counselors, and psychologists, as well as PhD clinical psychologists or someone with a PsyD, which is a different type of doctorate degree. So we're talking about people who have all been trained in behavioral health, and maybe they have different degrees and different licenses, but they're all pretty much doing the same thing. And that is they're helping people who have mental health disorders to relieve their symptoms. And part of talk therapy involves teaching what we call coping skills. So helping people to address their symptoms and really live life more in balance by teaching them how to cope. So that could mean things as silly as exercise, eating right, sleeping well, etc. It could also mean developing hobbies. It could mean, taking a hot bath to relax, doing meditation, doing relaxation techniques, visualization. There's all different types of coping tools that a therapist can teach a patient, which if they incorporate that into their daily life, they can relieve their symptoms. So you may have heard of cognitive behavior therapy, which is very, very common. It's helping a person to reframe what they're thinking, to look at things from a different perspective, to challenge their irrational thoughts. Okay, so changing their cognition, basically. So that's a very, very helpful technique with depression and anxiety. Also, you may have heard of dialectical behavior therapy, also known as DBT. These are a set of skills that teach people how to cope with emotional dysregulation and distress tolerance. So initially, this was created by Marshall Linehan to deal with people who have borderline personality disorder. And they have since discovered that it helps with people who have substance use disorders. And I'm going to argue that it can help anyone, because these are skills that I believe through learning about them that any of us can use in any situation. And these are also skills that they teach children, adolescents. Okay, so when a person engages in a DBT program, there's a classroom component where children and adolescents are seen with their parents. So the parents are learning the same skills at the same time. And then there's also individual therapy, one-on-one with the therapist. So DBT is a very big tool. There's so many others. There's behavior modification, there's hypnosis. You've heard of many of them. But people who engage in this type of therapy while they are complying with a medication regime are the ones who do the best. Now, there are people who don't need medication. If they start with a therapist and they start utilizing the tools that they're taught, they may be able to function better without even getting evaluated for medication. But medication is always on the back burner. So what happens with people who have depression and anxiety is they feel lousy and they want relief, and they want relief as soon as possible. So the best way to do that, many people think, is to use alcohol and other drugs because it's a pretty quick fix. They're going to feel better very, very quickly. The problem is this is not a good long-term treatment plan. Okay, initially it will work. It will relieve them of their discomfort. But what happens over time is alcohol and other drugs stop working. The anxiety and depression get worse. And for some people, they develop an addiction along the way. So it's not a good treatment plan. We caution people not to use alcohol or other drugs to cope. So everybody knows that people who are at a high risk of depression and a high risk of anxiety are also at a high risk of suicide, right? Because people who are suicidal are feeling incredible pain, and nobody wants to live with that pain. So the difference between a person who's suicidal and a person who's not suicidal, a non-suicidal person will say, I'm really struggling. This is miserable. I feel lousy. Maybe tomorrow I'll feel better. I'm getting help. There's hope. But a suicidal person will say, I feel lousy. It's never going to get better. And tomorrow's going to be worse. And I can't cope. I can't take this anymore. I can't live like this. I need to end my life. Okay, that's the difference. So you can see that if a person escalates to the point of being suicidal because of depression or anxiety, it is incredibly dangerous. Now, I don't want to tell you that everybody who has depression or anxiety is going to be suicidal. That, of course, is not the case, thankfully. But it certainly is a risk factor and something that parents and teachers need to keep their eyes open for. And people don't always say, I'm going to kill myself. What they might say is, I don't want to live anymore, or I don't care if something happens to me. So those are passive suicidal thoughts. Okay, but when someone says, I'm going to take a gun and shoot myself, or I'm going to run into traffic, that is an active threat that needs to be addressed right away. And when you're dealing with a potentially suicidal person, the correct thing to do is to ask them, are you having suicidal thoughts? Or are you thinking of hurting yourself or killing yourself? If you ask these questions, you are not planting the idea in someone's head. If they're not suicidal, they're not going to hurt themselves. But what happens when you outright directly ask the question is two things. It gives them an opportunity to ask for help if they want it, and it makes it okay to talk about it. Because in our society, the word suicide is very scary. So if you talk openly and honestly about it, you're giving permission to them to share what's going on. Okay, so you won't be planting an idea in their head. So everybody here needs to be aware, including young kids, that there's a new nationwide suicide hotline. It's if you dial 988, that will get you to a suicide crisis center where they have trained crisis counselors available to help anybody, any time of the day or night. So what I do with teens is I tell them to take out their phone and write suicide hotline or crisis center in their phone, in their contacts, and then the phone number 988. So it doesn't matter where a person lives, that number will get them where they need to be. They could be on vacation in California and they don't know, how to reach a crisis center there. They can call 988. So really important. And what I tell kids is you may never need this number, but someone in your life might. And if you have it in your phone, you don't even have to remember it. Just remember to look it up. So with that, I will entertain any questions or comments about depression or anxiety.
You guys can unmute and ask, or if you are more comfortable, you can type in the chat. Okay, well, if there aren't any questions or comments.
Actually, I do have a question.
Okay, go ahead.
So I know as a teacher here who has interaction with students that we would never want to have a conversation in which we were in any way trying to diagnose or tell a student that, they have depression or that they have anxiety. What type of conversation do you think that a teacher could have? What could a teacher say that would then point that student back to their parent? And of course, we can also call their parent and say, hey, your child said such and such to me, which just made me think I needed to call and tell you. But what would your suggestions be in the role that we serve as teacher?
Yeah, that's a great question, Cheryl. So you might have a student that you're noticing is maybe distracted, down, crying, anxious. What you could say is, I'm noticing that you appear to feel uncomfortable. What's going on? And they might say nothing. Well, I'm noticing that you're biting your nails or you're not as engaged with me as you usually are. I'm wondering if something's troubling you. Okay, no, nothing's bothering me. Okay, so you do know that if something's bothering you, I'm a safe person that you can go to talk about it. I'm always available. Your parents, you can go to them. But I'm worried about you because it seems to me like you're not behaving like you normally do, and I'm concerned. I care about you. I want to help you. So in other words, you're opening up the door. So they might not talk to you about that today, but tomorrow they might. Okay, but I would, if you're really noticing things that you're worried about, I would absolutely tell their parents, because you're virtual, right? You're not even there. So I think that a heads up to the parents is absolutely warranted, because what you don't want to happen is you don't want something to happen to the kid and then the parents say, well, did you notice anything? Well, yeah, I did. I noticed this and that. Well, why didn't you tell us? Right? So I think having open communication with the parent, and even saying to the student, I'm really worried about you and you're not willing to talk to me about it. So I'm just giving you the heads up that I'm going to call your parents and tell them to check in on you because I'm concerned. I really care about you and I want you to do okay. So not like I'm tattling on you, but I'm doing it out of concern.
Also, Cheryl, we discussed this morning, in our success coach meeting, it is absolutely okay for you to, on a routine basis, ask your students, hey, how are you doing today? How are you feeling today? Are you having any difficulty with anything? Can I connect you with either information or resources or someone else that you may feel more comfortable in talking with, especially if they are indicating harm or hurt to themselves. It's absolutely vital that you keep engaging with that student until you're able to reach out and connect them with the resources and the things that they need to have assistance. And absolutely reaching out to parents immediately when you hear anything like that is always the best course of action. And all of the success coaches that we have here, they have resources and information that you can use. Jeanette, you want to comment and jump in on
Thank you.
that?
Yes, we did. Today in our meeting, we discussed all that, and you guys just feel free, just like, if you're on a call with a student and you feel like they are suicidal, if you just send your success coach maybe a Zoom chat as you're going, and then we can just hop on and help you. The most important thing is always keep them on the phone and just keep talking to them, is what we discussed today.
Yeah, yeah. Any other comments or questions, you guys? All right, then we will bring this session to a close. Thank you so much, Lisa. Thank you guys for joining. I want to wish you all Merry Christmas, Happy
Merry
Hanukkah,
Christmas.
and Happy New Opportunities 2023.
Thank you, Ms.
Thank you.
Kaplan.
Thank
Thank
you.
you,
Thank you.
Tony.
All right,
Merry
we will
Christmas.
see you all in the new year.
Okay.
Thank you.
Bye bye.
Bye.
Bye.